Hi, good morning. I'm Valerie LaBean. I'm one of the nurse practitioners here at the clinic. Do you mind if I take a seat and we'll talk about your appointment today?
No, go ahead, take a seat.
All right. So what brought you to the clinic today?
I'm just here for my yearly physical.
All right. Are you experiencing any symptoms today? Any pain? Any shortness of breath? Any fatigue?
I have been having some menstrual problems, but other than that, no.
Okay. When was your last GYN visit or have your last pap smear?
It's been over a year.
Okay, so right now CDC recommends that people between the ages of about 21 to 35, roughly in that age group, gets their pap smear every 3 years. So it sounds like your pap smear is still good, but we definitely want to get that addressed. Do you have a GYN that you see?
I do, but I haven't seen them in a year, so
Okay,
not regularly.
Well, maybe it might be time to reach out.
Okay.
When you were a kid, did your mom vaccinate you? Did you get all of your Hep B, your measles, mumps, rubella? Did you get all of your shots?
Yes.
When you were between the ages of let's say 9 to 13, did you get the HPV vaccine that prevents against cervical cancer?
Yes.
Okay, I think it's called Gardasil. We really recommend it. That first vaccine was really a step in the right direction.
I agree.
Do you usually get your yearly flu shot?
Yes.
Okay.
Most of the time. Sometimes I might miss it by a few months, but I usually get it every year.
Okay. Do you go to the dentist regularly?
Yes.
Okay. Cleanings every 6 months, and then if they require any additional dental work, that could be decided then. Mm-hmm. What about eye exams? Do you get your eyes checked? Do you wear glasses, contacts?
I do wear glasses. I don't wear them regularly, and I am due for a new eye exam.
Okay, so we'll want to make sure that we stay on top of that. Vision's very important. What about any of your past medical history? Anything that you've been told you have or that you're diagnosed with or that you've been tested for?
So I have hypothyroid. I also have endometriosis. So having menstrual problems is not new to me. I have a family history of breast cancer.
Okay. Breast cancer, was it dad's side or mom's side?
It was both sides.
Both sides? Okay. And how old are you?
I'm 32.
Okay, so when you get a little bit older, I don't want to remind you, but mammograms will be very, very important, especially with the family history of breast cancer. Mm-hmm. Any other significant history in your family? Any other types of cancer? Anyone die under the age of 50?
Stroke is on both sides of my family. Both of my grandmothers have had strokes.
Okay.
And my grandfather.
Okay. What about any other types of cancer besides just breast? Okay. Your parents still living? Mm-hmm. Okay. What about any allergies? Any medication allergies, seasonal allergies, allergies to pets? Okay.
No, I don't have any allergies to pets. I have pets at home, and sometimes I get seasonal allergies, so I just take an over-the-counter Claritin or something when that happens. But other than that, no.
What about medication allergies?
Yes, a Z-Pak, azithromycin. I'm allergic to that.
Okay. Anything else? Okay. What about your social history? Let's talk about, do you smoke cigarettes or use any type of smokeless tobacco products?
No.
Okay. Do you drink?
Socially, sometimes.
What does socially drinking look like for you? How many times a month?
1 to 2 drinks, once a month.
Okay. So you said that you have 1 to 2 drinks socially, about 1 to 2 times a month. Is that correct? Mm-hmm. What about any illicit substances? Meth, heroin, cocaine. This is a safe place. I'm not here to tell the police. You can tell me whatever you want.
I mean, sometimes I might smoke an occasional joint.
Okay, but nothing hardcore cocaine, meth, heroin.
Sometimes I do edibles, but no, nothing like that.
Okay.
And then I'm always at home when I do them, and it's usually on the weekends, and I'm in a safe spot.
Okay. Do you feel safe at home?
Yes.
Okay, who do you live with?
I live with my wife and my 4 animals.
Okay. Good neighborhood.
Mhm.
You got access to fresh water.
Mhm.
Okay. So back to drugs and stuff. What about prescription drugs? Do you take any prescriptions, whether it be daily, weekly, every other day? Are there any medications that you take?
Yes. So right now I'm on 50 micrograms of levothyroxine. I'm on 20 milligrams of fluoxetine, and I'm on 500 milligrams of metformin.
Okay. And do you know what you take those for?
Yes. So my metformin is technically supposed to be for diabetic medication, but mine's not for diabetes because I don't have diabetes. Mine's for polycystic ovarian syndrome.
Okay.
And then my levothyroxine is because I have a slow thyroid, so I have hypothyroid. And my fluoxetine is just for like seasonal depression.
Okay. And do you take anything else? You take prescriptions that aren't yours that we should be concerned about? Opiates, benzos, which would be like maybe Ativan or Xanax?
No.
Okay. We're going to skip it, but at this point I would ask about sexual history, if they were using protection, if they were being safe about it, and like how many partners, last STD testing, all of that. But don't want to make anyone uncomfortable, so we're not going to ask about that. So, have you ever had any surgeries in the past? Any times you've been put under anesthesia, whether it be for a scope, a procedure, general surgery? What does your surgical history look like?
Very, very minor. So I had an adenoidectomy. I had my adenoids removed when I was like 8 years old.
Okay.
That's it.
All right. What about any scopes or anything?
I did have tubes put in my ears when I was a child as well, but no scopes.
Okay. So we're just going to run real quick through some objective things. I'm going to ask you some questions about like each of your body systems just to get a general idea.
Mm-hmm.
So let's just start with like a general exam. How has your weight been lately? Steady? Are you gaining, losing, maintaining?
I've definitely gained weight this year. I was in a car accident last year, so it's definitely made my mobility stagnant because of my back pain from the car accident.
Okay, and how much would you say and over what period of time?
Like 50 pounds within a year.
Okay. What about fatigue, weakness? Have you had any chills, fevers, night sweats?
None of that. I've definitely felt fatigued, definitely feel tired. And I also like have trouble sleeping sometimes because of my back pain.
Okay.
And sometimes I take over the counter like Tylenol Motrin because I don't like to take anything else.
Right. Okay.
That seems to help.
Okay. Do you take anything else over? You said Claritin. Anything else over the counter?
Besides Tylenol Motrin?
Correct.
No.
Okay. What about neurologically? Do you ever have any like numbness, tingling, any like shooting pains down your legs, headaches?
Because of my car accident, I do have tingling in my left foot and my left leg. Sometimes my left foot goes numb at the top of it.
Okay. And you follow with the orthopedic spine team for that?
Mm-hmm.
Okay, perfect.
And they put me through physical therapy, and I had 2 MRIs.
Okay. And they're managing that care pretty well?
Mm-hmm.
Perfect. What about like HENT? When we talk about that, in case you don't have a lot of medical background, I do want to make sure. It's just, what about any like ear pain, eye pain, any drainage from your ears, any nose drainage, any pain on your face, any headaches, fullness in your ears, any throat pain, difficulty swallowing?
So I did have tubes put in my ears when I was a kid, but I have always had ear issues. So sometimes I feel like there is always extra fluid in my ears, and I do feel fullness, but no other pain. So no face pain, no throat pain, or anything like that.
Okay. Have you seen an ENT about that in the past?
A long time ago when I was a kid.
Okay. So maybe we should touch base with ENT again just to keep an eye on your ears, make sure everything's looking good. I will definitely take a look in them, but I do also like to include the specialties because they are the professionals in this field.
Okay, that's fair.
What about any musculoskeletal? I know you said you have some weakness and stuff from your back, but are you able to walk? Are you able to run? Are you able to move your arms and legs freely?
I'm able to walk. Definitely not able to run. I can move around freely, but again, if I walk for a long time, my lower back pain starts to increase. And I'm definitely not in a point in my life where I could feel comfortable running.
Understood. Understood. What about any skin? Have you noticed any skin changes? Any weird bumps, bruises? Man, I don't know where that came from type thing on your skin anywhere that would be of concern?
No, I haven't seen any places.
Good, good. Okay. What about any gastrointestinal problems like constipation, diarrhea, heartburn, indigestion, extra gas, anything?
No, I not that I can recall.
Okay. What about any chest pain, palpitations, chest tightness?
Mm-mm.
Any difficulty breathing, shortness of breath?
Nope.
Anyone ever tell you that like you wake up in the middle of the night not breathing?
No, I have been told that I snore very loudly.
Okay, okay. So you told me about your hypothyroid for endocrine, that you don't have diabetes. And then we touched base on your psychiatric history and how you feel about that. You take medication for seasonal depression. Any thoughts of harming yourself or harming someone else?
No.
Perfect. Have you ever had any abnormal blood work or anyone tell you that like something's wrong with your blood work? Any times you've needed blood transfusions?
The only time I've ever had anything come back and like my blood work was like with my thyroid levels were off, but
Okay.
other than that, no, nothing else was abnormal.
Okay, perfect. Can I do a physical exam?
Yes.
Okay, perfect. I am back, so we can do this physical exam. So, the tech or the MA has already come in and done your vitals, right? Like your blood pressure, temperature, respiratory rate. They check your SpO2 with the probe on your finger. We did your height and weight out on the way in on the scale.
Yes.
And I just got to calculate your BMI.
Yes.
Okay, so that's always important. We always want to start with vital signs. Those are the main signs of life. So as I walked in, vital signs were done. We would do a general survey. She looks healthy. She's not in acute distress. She's dressed appropriately. She has good hygiene. All of the things we'd be looking for a general survey are all checking out okay. We could move on to our systems now. We would start with psychiatric symptoms. So we could do an evaluation of that. We'll move on to just a general survey. When I walked in the room, she was in no acute distress. Hygiene looks good. She's appropriately dressed. When we did the interview, she was A&O times 4. She has a good thought process. She's not confused. She's appropriate mood, affect is all within normal limits. The next thing we would look at is skin. So her skin looks clean, dry, and intact. We would be looking for any bumps, any raises, any rashes, any discoloration. We would evaluate it for what it felt like, if it was like a raised bump or if it was smooth with the skin, if it was regular shaped or irregular shaped. And we would make note of it, keep an eye on it. We want to watch for growth. If her next follow-up it's gotten bigger, it looks darker, we would definitely want to look more into that. So when we talk about the skin, we're looking for lesions on the skin, discoloration, moles that maybe weren't there a year ago. We could also look for edema. A lot of times you see edema in the ankles. You would palpate them, see if it's pitting. You could also look for, test the skin turgor. You would squeeze the skin and you would want it to drop back down within 3 seconds. After skin, we could definitely move on to neurological, Like I said, neurologically, she is of sound mind. She has an appropriate thought process, and she is pleasant, not in acute distress, and she is cooperative for the exam. We would move on to head. We would check hair, her hair distribution. You check that wherever there's body hair at. You want to make sure that the pattern is the same, that there's not like huge bald spots. We would measure symmetry. We would want both sides of her head to look the same. We would look for if there's bumps, bruises, anything abnormal. We would also check her hair. You want the pattern to be the same. You want the distribution to be equal. You don't want to see a bunch of different bald spots. That would be part of like your head and your skin exam. The next thing we would want to move on to would be eyes. So for the eyes, we're checking the sclera, the conjunctiva. We're making sure there's no discoloration, no drainage, no redness. You would also do an internal eye exam with an otoscope or a optoscope. I don't know. You would do an internal exam with a light. I don't have a professional light with me, but I do have my flashlight. So we would do an internal eye exam, and you're looking for, you're checking the disc, the veins, the vessels. You're also checking for the red reflex in the back of the eye. And you would do that by just gently lifting their eyelid if they're having a hard time keeping it open, or you would just have them look directly at your nose. You would shine the light in their eye. And if I had an eye scope, I would be able to see her optic disc and all the other parts in there, the vessels and the color. When we talk about the external eyes, we're looking for perla, which is a term we use in nursing all the time. So it means pupils are equal, round, reactive, reactive to light with accommodation. You would want accommodation in the eye you're looking at with the light, and in the opposite eye. You would want them both to constrict. And that would be part of the eye exam that we would be looking for. When we move on past the eyes, we would go to the ears. A big thing is palpation. When you push on a patient's tragus, which is the tiny little flap of the ear right here, if I was to push on hers and she had a reaction or there was pain, we would definitely be thinking of like swimmer's ear or external otitis media. And we would, that would be the concern with the pain on the outside. You could also palpate, see if there's any pain anywhere else on the ear. And then you would look inside the ear. You'd want to make sure you use your instrument safety, that you're not going too deep to puncture the tympanic membrane. You want the tympanic membrane to be opaque. You don't want any holes. You don't want to see any drainage. You don't want to see it bulging. All of this would be areas of concern. If I had an otoscope, I would hold it, use my fingers, make sure my pinky was on the front of her ear here so that I wasn't going too deep with the otoscope. I would pull the top of her ear up and back. That's what you do for adults. If she was under the age of 18 or a child, we would pull it back and down, and that gives you a good look into the ear canal. Moving on from the ears, we would go on to the nose. I would take the otoscope, put new caps on it, and look in the nose. Again, you're looking for symmetry. Like, is the septum in the middle? Do both nostrils look the same? Is the color good? Is there drainage? Is there bleeding? Is there swelling? You would want both nostrils to be patent. You could have her smell something. Make sure she has a sense of smell in both nostrils. If we go back to the ear, we could do the Weber and Rhine test to check for hearing. Weber would be putting the tuning fork on the top of the ear, putting the tuning fork on the top of the forehead. And then the Rhine test would be bone and air conduction. Those are really good tests to test for hearing. We could also do the whisper test for the ear. For the nose, we would do smelling. This would test some of our cranial nerves. We would move on to mouth, throat, voice. We would have her talk, make sure the palate elevates when she talks. When we look in the mouth, we're just looking for any changes, any discoloration, any swelling, any redness, any pain that she's having inside her mouth. We would make sure when she says ah, her uvula elevates, and that the tongue is midline, and that she is able to move her tongue back and forth, that she's able to say ah when we check her uvula in the back, or we check like the back of her throat and we use a tongue depressor and make sure she has a gag reflex. And all of that would be very important when you're assessing the mouth, the throat, the voice, all of those types of things. All right, so for the next body part that we would want to assess, we would move on to the neck. We're checking for the thyroid, make sure it's midline, check the trachea. We would definitely want the trachea to be midline. So we would check her throat, the external throat. We would check the neck. We're looking for the trachea to be midline and the thyroid to be midline as well. You could palpate the lobes of the thyroid from the front or from the standing behind. You would assess the thyroid and make sure that they are smooth, and when she swallows that you can feel the isthmus. We could move on to cardio. Before we move on to cardio, we also want to check all the lymph nodes, make sure there's no swelling, no tenderness, and then we could move on to cardio. We would listen to all her heart sounds with the diaphragm and the bell, and the 5 points, which would be aortic, pulmonic, Erb's point in the middle, mitral, and tricuspid. And we would be listening to those with the bell and the diaphragm of our stethoscope. We would also be listening for any murmurs or any additional sounds like S3 or S4. We would also move on to respiratory. For respiratory, you want to listen to the front and the back. You kind of just zigzag down the chest. You want to make sure you're hitting all the lobes. You have 3 on the right, 2 on the left, and you want to listen for any adventitious breath sounds like crackles, rails, if they're diminished, if there's absent lung sounds. And you always listen to the front and the back if the patient is able to sit up. You could also have them say 99 as you're listening to breath sounds to hear the voice quality through the lungs. You could also, in between their ribs, feel for vibrations. You could listen to the resonate through her lungs too when you have her say 99. You could also, can you turn for me? You could also palpate in between the ribs and put your hands up and have her say 99, and you're listening. You're not listening. You're feeling for the vibrations through her lungs. You could also check to make sure her diaphragm is going up equally by holding her on the sides here, having her take a deep breath, and making sure your thumbs come together and apart equally. And when you listen to breath sounds, you listen on the front and on the back, and you kind of listen in like a zigzag pattern, but you want to make sure you hit both sides of all of the lobes. And while we're also listening, there is a spot that we want to listen to while we're having her turn and listen to the front and the back, called the PMI, and that is for cardio, but we can hit it now that we have her moving around and we are using our stethoscope a lot. If you could turn this way towards me just a little bit, the PMI would be right under here, and we would listen for that that would be under your cardio sounds, and that is your point of maximum impulse. So for the next part of the exam, we would do the abdomen. We would do palpation and auscultation. We're going to do that in all 4 quadrants. So we would, the stomach would be 4 quadrants. So upper 2, lower 2. You're listening for bowel sounds in all 4. When you palpate, you're palpating the liver. The spleen you probably won't be able to feel, but if there's tenderness, we definitely need to be worried. You would do light and deep palpation. You could check a couple different things for like appendicitis. You could make sure like the liver's not enlarged. And you would do that by palpating lightly and deeply, all 4 quadrants. After that, we would move on to musculoskeletal. So when she walked into the room, I watched her walk. I would have her walk again. She could walk toes in front of toes, like heel to toe, heel to toe, squat, stand. You would just be looking for any signs of weakness, unsteadiness, inability to perform a task. Lastly, we would wrap up with the rest of the neurological exam. You would, we've already done a lot of it, assessing orientation, assessing her walk, assessing how well she can talk through the interview part. So a lot of that has already been covered, which is really nice. And the last thing we would do to wrap up this exam would be just kind of like an overall peripheral vascular assessment, like pulses. We would check her dorsal pedis pulse in the middle of her foot, radial pulse on the wrist, cap refill, skin turgor. We've already done some of that. We would want to make sure that it looked like she had good circulation. And then we would always want to end the exam with, do you have any questions for me?
No, I do not.
All right. Thank you, Crystal.
Thank you.